So she is loving her life.
Well, I have gone ahead and hit record. Go ahead, Dr. Byron.
No, I was going to say, have you been baking any kidney cookies lately?
I did bring the human kidney cookies on my first day. Everyone loved them. I haven't done the dog kidney cookies yet, though. Mainly just because I haven't had a AKI patient that has survived yet. So here we are.
All right. Well, I have hit record and it is 12 o'clock. So if you want to go ahead and start, you are welcome to do so.
Okay. I am Mandy Spillane. I'm a criticalist. I'm currently at Access in Los Angeles, restarting the extracorporeal therapies unit, and obviously doing the ACVNU residency. This is my cat, Zoe. I'm trying to get her in the advertising for Access because she's perfect and she has a kidney on her tiara. So let's get going. Today we're going to talk about apoptosis inhibitor of macrophage or AIM protein and its association with AKI and CKD. Today, as I made this presentation, it was quite a lot of material to get through, so we're just going to focus on these two papers. The first one looks at kind of the AIM protein in a mouse model. The second kind of relates that to kidney disease in cats. Just a first question, who has heard of the AIM protein before? If you have, just do a thumbs up or a raise hand or something of that nature. Langston has heard. Okay.
But I can't do my thumbs up, but I've heard of it a lot.
Okay. Awesome. So there's a few there. To be honest, I haven't heard like too much about it, just briefly, until recently. This drug actually went viral on TikTok recently, and my Los Angeles people very down with TikTok, it seems. So there's been a lot of talk about this video, which I'm just going to play it for everybody first. Can we see the video? Probably not. Let me. I think as specialists in the renal community, with this sort of advertising, kind of I've had multiple pet parents ask about it, veterinary staff. So I think it's something important for us to be aware of and knowledgeable about, which is why I chose the journal club topic today. Just to give a bit of context though, before we start, I'll just play this quick video. Okay, hopefully that played okay. If not, I'm sure you could hear the audio. But this viral video, like lots of people have asked about it, it's making pretty big conclusions in terms of what it can offer. So there's been lots of interest in inquiring about this drug, even though it's only in Japan in the clinical trial phase. So So I thought it would be helpful to kind of go through the papers we have available on this drug. So obviously we all agree that there's no definitive treatments for AKI unless we're dealing with something like lepto or pyelonephritis, and treatment relies on supportive therapy and giving the kidneys time to see if they will recover or not. We can certainly conclude that acute kidney injury is going to increase potential risk for CKD. And in cats, CKD etiology remains elusive. We know that cats have kind of a high incidence of developing chronic kidney disease. It's unclear kind of are there multiple AKI events that ultimately result in CKD? Is there a low sustained injury to the kidneys that culminates with CKD? Is there another mechanism? The jury's still out. And the modulation of progression from AKI to CKD is something that's really interesting that we don't kind of fully understand or have therapeutic points to modulate. Renal tubular obstruction is a key component of the pathophysiology of AKI, as obstructed renal tubules due to dead tubular epithelial cells is going to obstruct the tubular lumen and result in decreased GFR, release of inflammatory mediators. Renal tubular epithelial cells we know can either undergo apoptosis or a programmed type of necrosis. And we know that the proximal tubular cells in the corticomedullary junction seem predisposed to this process. And this will ultimately worsen tubular injury and make recovery from AKI more challenging, as we need regeneration of healthy tubular cells, but also removal of any intraluminal debris for recovery to occur. So how are renal tubular debris removed? Traditionally, we have professional phagocytes like macrophages, dendritic cells, granulocytes. These generally have very low numbers in the tubular lumen. Is a bit of an exclusive area for these professional cells to migrate into. We know that kidney injury molecule 1, KIM1, does get expressed when there's injury to the tubular epithelial cells, and this molecule is believed to induce de-differentiation of renal tubular cells to become phagocytes, and it's believed kind of these are involved in clearing that intraluminal debris via engulfing the material. Apoptosis inhibitor of macrophage, or AIM as I'll refer to it for the rest of this presentation, has been identified to be a KIM1 ligand, so they seem to have a very intimate relationship, which poses the question of what is AIM. So it's produced by tissue macrophages. It supports macrophage survival, and normally it's found to circulate in blood associated with IgM, which is going to, in healthy states, protect it from renal excretion. It can also bind to LPS, fatty acid synthase, regulators of the complement cascade. It can also be endocytosed. In humans and mice, it's present at levels of about 5 micrograms per mil, and it's found to be involved in the pathogenesis of obesity, insulin resistance, immune diseases, other diseases, mostly in humans. Interestingly, kind of a lot of the literature I found on AIM all kind of originates from similar authors. So it doesn't seem like there was like lots of different papers all across the world. To me, it seemed like a lot of the papers were coming out of similar institutions. So during AKI, the concentration of AIM is believed to increase in the urine. AIM is thought to kind of tag necrotic cell debris and accumulate kind of in this area, particularly within the proximal tubule lumen. AIM within tubular debris then binds to KIM1 that's expressed on injured tubular epithelial cells, and it's this kind of relationship that enhances phagocytic removal of this debris, ultimately contributing to renal recovery and repair of the tissue. And the question is kind of firstly, that sequence of events, are we kind of confident that's how it unfolds? And then secondly, does lacking AIM result in reduced debris clearance and persistent renal inflammation that would ultimately lead to higher mortality from AKI, as well as potential progression to CKD? So we're going to go through this first paper. It looks at the AIM protein and how it enhances intraluminal debris clearance, helping with acute kidney injury recovery in mice. This is kind of the initial like experimental study I could find that's looking at AIM. So we're going to go through that study, as I think it's important to understand like where it comes from to then look at kind of subsequent studies. Interestingly, so these papers came out of Asia. The format was is quite different to papers published in like US and other international journals. The methods of this paper I tried to source. It said that it was available in the online form of the article, and then trying to track that down, it really wasn't accessible to me. But piecing together kind of from the paper, the other parts of a traditional paper were there. Tried to kind of piece together like a very basic overview of the method, but it really doesn't like go in depth into the methods for this paper. It's an experimental animal model. They had a few different groups in terms of this study was based in mice only. There's a group of wild type mice that have like normal AIM protein, no alterations. There's then a group of mice they genetically modified to be deficient in AIM. And then they also had a group of 6 mice where they delivered a sham treatment when they're comparing the results. With these mice, it's an experimental model of AKI. So what they did to induce AKI is based off a ischemia reperfusion model. So they effectively anesthetized the mice, opened their tiny little abdomens, clamped their renal vasculature for 30 minutes, and then they unclamped it, measured their renal values, was a pretty consistent way to cause AKI, unsurprisingly. And then they monitored like renal values for 7 days, looked at survival of mice overall, and compared those things between the wild type and the AIM deficient mice, as well as the sham treatment groups. And then at various time points, they obtained kidney specimens for histopathology, other tests at those time points. So I'm going to go through the results. I think this was interesting for me because I don't typically read a lot of experimental mice studies. To be honest, some of it was fairly complicated. So I'm going to do my best to kind of go through and make sense of it, but kind of unique compared to most of the veterinary and human studies we look at are more clinical. So it was interesting, but a little bit confusing, to be honest. The first figure, so all of the figures through these papers, kind of as their title, they pretty much have like their conclusion from the data. So it's not a like non-biased figure title. It's kind of like effectively what they think their conclusion is, which was interesting. So the first figure is looking at the data where they're concluding that there's impaired recovery from ischemia induced AKI in the absence of AIM. So we have 3 different figures here. We have the first looking at the BUN concentration, the second looking at creatinine, the third looking at the survival rate. And we have the wild type mice, which is going to be these open circles. And then we have the AIM negative mice where they didn't have that protein genetically. So that's going to be the black squares. And then the sham treatments is this gray boxes down the bottom. So we can see that at day 1, between both the wild type and the AIM negative mice, there was a similar elevation in their BUN and creatinine. At that point, we can see that the wild type mice had reduction in their renal values after that point, suggesting renal recovery, whereas the AIM negative mice continued to progress, but then also there was a little bit of recovery potentially, but the numbers in parentheses is the number of mice that died at each time point. So we can see, like, as we go across, like, there's really not many mice kind of as we're looking at those subsequent days. And that's easier to look at in figure C. We can see the wild type mice, so it's about 100% almost survival rate, whereas the AIM negative mice, we can see that survival rate is decreasing as we progress through the 7-day period, with almost 70% mortality by the end of their study period. And they did note the mice that survived at that point were very emaciated in the AIM negative group, but kind of almost half of the mice were dead by day 3. The second figure here is concluding that we get impaired clearance of intraluminal debris and defective tissue repair in AIM negative mice. And what we can see here is we have some histology images looking at kind of pre-treatment in the wild type and the AIM negative mice, and then as we go through day 1, 3, and 7. On day 1, we can see that the proximal tubular cells are impaired with luminal obstructing debris. So that's in both groups. And Rachel, I apologize, my knowledge of pathology is limited. So feel free to jump in after if you have anything to add. What they conclude is at day 3 onwards, there's less intraluminal debris and a bigger brush border in the wild type mice compared to the AIM negative mice. So just looking simply here, like it looks like there's more like open intact tubular lumens compared to these images. There seems to be a lot of content still intraluminally. The second figures here is looking at like the clearance rate of intraluminal debris and then the brush border. And it is comparing the black bars is going to be AIM negative mice, and then the white bars is going to be the wild type. And the little asterisk is where there was statistical significance detected. So those first two we can see at day 7. The AIM negative mice had more intraluminal debris, and then a smaller brush border, suggesting like reduced clearance of the intraluminal debris. And then the bottom figure here, it looks at the acute tubular necrosis score, and compares that in both groups, kind of pre-treatment and then day 1, 3, and 7. And again, on day 3 and 7, they found that there was a greater rate of acute tubular necrosis in the AIM negative group of mice. And to note, like with this study in each group, as they break it down, there's really not too many mice. Like some of the comparisons is only like 5 mice. So it's pretty interesting, but I think cautious in how we should interpret it. Figure 2 here is looking at the clearance of intraluminal debris, defective tissue repair in AIM negative mice again. They went ahead and did some mRNA levels of inflammatory genes and compared those between the 2 groups. And they found that in the AIM negative mice at day 7, there were higher levels of some of those inflammatory genes. I think it's challenging to know here, like there weren't any of the asterisks. It wasn't well described how they were assessing for statistical significance. So I found it a little bit challenging to kind of take away something clinically significant, as we can see like some of these bars, like at day 3, are pretty similar, honestly. So I'm not sure if that was actually significant or not. I thought it would be helpful to kind of review what an acute tubular necrosis score is. And in the paper, they referenced kind of the score, but then I tracked their like in-text reference, went to that paper. It didn't mention anything about it, so I'm not actually sure how they scored this in this study, but I found acute tubular necrosis score from a separate paper and kind of looked through that just because I wasn't super familiar with it. And effectively what they do is they fix the kidneys, section them, and then stain them. And then they look at the histological changes and quantify the proportion of tubules that have cell necrosis, brush border loss, cast formation, and tubule dilation. And then they score it based on like the percentage of tubules expressing those abnormalities to give us a score from 0 to 5, with 5 being the most severe. So if we go back here, we can see like on this figure, we have like 0 to 5, and certainly like in both groups at day 3 and day 7, like they're still elevated, but the wild type mice we can see is improving versus the AIM negative mice is staying kind of at a similar level. Moving on through some of the results, they suspect there's a chronic inflammatory response to ischemic AKI that's worse in the AIM negative mice. Both types of mice were challenged, like initially with bilateral occlusion of the renal vasculature. All of the AIM negative mice, though, died within 7 days, so it was then challenging to assess any other variables since they had all died. So what they went ahead and did next was just unilaterally occlude the renal vasculature And then at 28 days, to get a longer follow-up, they looked at the histology of those kidneys, and they found that there were higher levels of leukocyte infiltration and tubulointerstitial fibrosis in the AIM-negative mice. And there was a higher level of mRNA levels of those inflammatory genes and fibrogenic genes, as well as kidney injury markers. And some of this, like throughout the paper, is described in text. Some of it has the figures. It seems like a lot of the findings that didn't conclude anything significantly are included in supplemental figures that are difficult to access. And then any results that were significant, they represent like within the paper graphically. So I think that was interesting in that they're kind of emphasizing their significant findings and then kind of brushing over ones that are less significant. With their results, the question is, does AIM influence KIM1 expression in injured tubular epithelial cells? They did immunohistochemistry that revealed KIM1 was induced equally in both the wild type and the AIM-negative mice. So first, they wanted to make sure that their differences wasn't because like KIM1 expression was different between the groups. So they went ahead and like assessed for that, and it seemed equal. At day 7, there was also higher levels of KIM1 present in the AIM-negative mice versus the wild type mice. So their suspicion was that we were having delayed recovery from AKI, hence why at 7 days there was still the kidney injury markers in the AIM-negative group. Wild type mice had prominent AIM staining within the intraluminal debris, whereas the AIM-negative mice did not. And they kind of talk about like the relationship to where it's suspected we need AIM deposition as well as functional KIM1 to clear that luminal debris. So here are some images where they try and explore the relationship between AIM and KIM1. So this kind of these images here are where they're like trying to look at like the overlap between the KIM1 and the AIM proteins. So my interpretation, I'm not super familiar with this form of testing, but they were looking like at the structure of KIM1, which is like the red color, and then the AIM, which is more green. And then they looked at kind of overlapping the structures to see how similar they were. And I think the suspicion is if they're very similar, that they're kind of bound together. So the first image is kind of looking at that. And then what they're doing is taking KIM1 out of the mice. And they can see like that made that overlap 0% effectively. And then in the second image, they're looking at KIM1 variants. So pretty much like dysfunctional forms of KIM1. And for each of these, there's a control group. But then as they made the KIM1 dysfunctional, that overlap was not there anymore. So they kind of concluded based off that AIM binds to KIM1. So it was a little bit confusing to me. If anyone is more inept with this sort of testing, certainly feel free to jump in. The other figures here we can see was looking at kind of KIM1 positive groups, and then pre-treatment day 1, 3, and 7. The white bars is looking at the wild type mice, and then the black bars is when they were negative for the AIM protein. So we can see kind of the difference at day 7 after they started. Similarly, as we move through, these results here, we're trying to demonstrate that AIM accumulation enhances engulfment of that intraluminal debris, and that being mediated by KIM1. So in the wild type mice, KIM1 and tubular epithelial cells were tightly surrounding AIM-stained luminal debris. So that we can see, like in this first image, this was at day 3 post induction of AKI. And the green stain is going to be what they're marking as the AIM protein. So we can see that like in the wild type mice, the AIM negative mice, we can see there's no green staining, and then they compared it to humans, which I'm unclear exactly like the methodology of how that was obtained, but interesting. So then the next images here, the white arrows is going to indicate engulfment. So the AIM protein is the green labeled dye. We can see in the AIM negative group, I think that's just marking like where the tubular debris is, and it's not phagocytosed, whereas in the AIM positive group, it seems like the green dye gets phagocytosed, and the little arrows is like marking the areas of phagocytosis. And they were concluding that the AIM proteins required for that engulfment of debris. So that's kind of in both like B and D. And then from there, they kind of suggest that KIM1 and AIM are both involved in phagocytosis and clearance of intraluminal debris. And then they compare the percentage of phagocytosis in different groups that we can see there. So then next what they do is they were looking at kind of in serum, it seems like AIM is bound to IgM kind of in the healthy state, and then during AKI the AIM becomes free and then is excreted into urine to where it binds the tubular debris and is helpful. So they were looking at kind of pre-treatment here. We can see is the IgM bound AIM, and then kind of low rates of free AIM. Then as we get through day 1, we can see like the color of the IgM bound AIM gets a little bit lighter, suggesting there's less of it, and then we get more free AIM. And then as we kind of go through, the free AIM kind of decreases as it's cleared into the urine. And then these graphs were also kind of looking at that relationship. So on day 1 is where we got an increase in the urinary AIM, and then the free AIM in serum. So both of these kind of looking at a similar thing. They also looked at the severity of azotemia, if that was associated with the level of free AIM. So we can see here there's lots of different data points and then a line of kind of best fit. I think that they concluded that was significant. I think just looking at the data points, to me, it seems like pretty variable. I'm not sure like that exact trend maybe is subtly there, but doesn't look perfect. But there is some degree of relationship. And then down here it was pretty similar to where they were looking at, like in humans, the urinary level of AIM in like healthy people versus acute AKI, and then recovery, it decreased. And then looking at free AIM and like healthy and AKI, there was statistical difference. Again, like the methodology of how the human side of things was not well described and a bit confusing, but interesting to see. And in people, it seems like there's consistent like free aim in AKI. And in terms of like how they discovered it's bound to IgM, I think that they were looking at the size of IgM and then like labeling AIM, and I think they kind of concluded they were similar sizes. The methodology was a little bit challenging for me to understand, but it seemed like, yeah, they were kind of radio labeling the AIM and then measuring like the molecular weight and concluding that was IgM. Figure 6 here is looking at how recombinant AIM, so effectively like synthetic AIM, they were injecting into these mice was facilitating recovery from AKI versus a control treatment. First they looked at the survival rate overall of mice that got recombinant AIM when it was administered as noted by the black arrows, so day 1, 2, and 3 compared to the control group. And then they looked at the renal values. Again, kind of when they injected is the same, and we can see that in the recombinant AIM group, there was similar increase at day 1, but then there was plateau and recovery. Of course, this is only over a 7-day period. And then they also looked at the rate of intraluminal debris again, brush border, between those groups, as well as some histology images. And then the overall survival rate of the AIM positive, like recombinant group, was higher than kind of the control group. Almost all died. This is again in mice. So that is kind of the end of the results from that first paper. I know it's a lot. I think it's helpful to like go through it to kind of try and understand where this is all coming from, to understand like the feline paper that we'll go through next. The study limitations, though, I think are quite major. The methodology of the paper like isn't accessible easily, not well described. It's an experimental model. So does in vitro testing and results like translate to in vivo effects? Do effects in mice translate to other species? Also, is ischemic reperfusion injury induced AKI an appropriate model to look at when we're talking about clinical AKI and then potentially CKD? The sample sizes were very small within groups. The study period was only over 7 days. And the conclusions, like throughout the text, even like for the figure titles, was pretty bold. I think it's clear like there's a relationship, but some of the conclusions were quite bold. And then some of the in-text citations couldn't really be traced. Are there any questions, concerns before we move on to the feline paper?
I think you did a good job of discussing the renal pathology findings. I think that a problem that often happens on these types of papers is what pathologists call postage stamp pathology, which all you see is the tiniest little vision of a kidney. And having looked at how many rat or small animal or large animal kidneys, you can always find a focus somewhere of something. So I think the pictures they chose were true to the lesions they described, but then assessing how much of the kidney was affected by that is very difficult to do from the size of the picture that they presented.
Right. And I don't know like how many fields like did they look at in the kidney. Yeah. certainly, yeah, helpful to get your input, Rachel. A lot of that was a little bit over my head, but it makes a bit more sense now. So good exercise to do. Let's move on to the feline paper. To me, this is like clinically a little bit more relevant than mice, but just to prepare everybody, it does have mice in it again. So there's more mice. Again, the methods of this study was not well described in the paper this time. They did have a methodology section. To be honest, they went through a lot of the like specific testing protocols, but less so about like the overall study design. But going through the paper, it was non-randomized and it was non-blinded. So when they were interpreting results, they knew which group the mice were in, except when they evaluated the intraluminal debris and acute tubular necrosis score on the histology images. That was blinded. Everything else was not blinded. They also got some serum from healthy cats with owner consent to look at kind of AIM protein information from that. And then there also was a group of cats that, similar to mice, had ischemic AKI induced. It was not described though, like where those cats were sourced. It was unclear, like, was it the cats, the healthy cats that had serum evaluated like from owners, but then they like underwent ischemic AKI and were eventually euthanized, versus did they source like shelter cats or purpose-bred research cats? It wasn't described at all where those groups came from. And in the methodology, they mentioned briefly about kind of with the cats, they induced ischemic AKI in was a similar process to mice in terms of occluding the renal vasculature. I did have some ethical considerations with their anesthesia protocol for these cats. They administered atropine as a pre-medication and then induced the cats with propofol. And then post-operatively, like they received a dose of buprenorphine, and then they were studied like through the study period, and then they were euthanized like with pentobarbital and potassium chloride. So I did have some ethical concerns with the study design. It did say it was approved by the ethical committee in the institution, but just a couple of things to mention there. And then the next part, they had an experimental model in mice. So effectively, they isolated the feline AIM gene, and then they took mice's genes and then like genetically modified it to put the feline AIM gene into the mice. And then they looked at like those mice had ischemic AKI induced. And then they compared it to wild type mice that had like regular AIM, so not the feline modified one, it was just the regular AIM gene in mice. And then they kind of compared between those groups. So there was like multiple like separate parts to this study. It was a little bit confusing, like with how the methodology was written. And that was at the end of the paper. So kind of flicked to that first. But then as you like roll through the results of the paper, it kind of jumped from part to part. So it was a little bit confusing for me to follow, to be honest. But that's kind of like trying to make a bit of sense of it for you guys kind of going through. So to go through the results, so first they took like serum from the healthy cats, humans, and then mice, and they isolated the gene for AIM. So they compared it to the human and mouse AIM. This first image is looking at like the genetic similarity. So the black letters is going to be amino acids that are identical between species. The gray letters is going to be where they're similar. And then they kind of like compare between those different species. And in the paper, they said they did this from a sample from like one cat's spleen. So I am not an expert in like genetic testing and isolation of genes. It was interesting. It was like just from one cat. I'm not sure if like if we're trying to novelly say like this is the gene in cats. To me, it would seem like we might need to test multiple cats, but I'm not an expert, so I'm not sure if that's how it works or not. But this was from like one cat's spleen is where this was isolated. Secondly, here we can see they injected an anti-AIM antibody. So effectively, they wanted to label the AIM protein in cats. And then they assess the molecular size. And in people and mice, there seemed to be like just one size of AIM. In cats, there was 3 different groups. So the first group here we can see was like 37 kilodaltons only. Then we get a second group which has both 37 and 49 kilodalton sized AIM, and then there's a third group that has just 49 kilodalton AIM. So they kind of then suggested in cats like there's 3 different groups to where they can have like variability in their AIM protein size. They then assess like in the healthy cats, which was, they just said over 30 cats. I'm not sure exactly how many cats it was, but they looked at the AIM level and then compared it to mice and humans. In cats, it was markedly higher at 21 micrograms per mil versus 2 to 3 in mice and 5 in people. I'm not sure if like the tests they use to measure AIM levels, like how validated that is to kind of take and use in a new species. I'm not sure. So just something to note there. And then they also measured, since the overall AIM level was way higher in cats, they measured the IgM levels because they wanted to see, like, is it higher because there's more IgM in cats versus people and mice. So they went ahead and measured the IgM levels, but the IgM levels were the same as people and mice. So they concluded like the overall AIM level was not higher because of the IgM. And again, like they went through how the AIM protein seems to bind to IgM in cats based off like looking at like the marker of it and then looking at the molecular size of IgM. And they kind of took a positive correlation like between serum AIM and IgM levels. Because of them like being similar sort of molecular weights. Then what they did was they took the feline AIM mRNA and analyzed it. They found that the 49 kilodalton AIM possessed like 4 cysteine-rich domains compared to the other size of AIM had 3 cysteine-rich domains. So they suspect the 49 kilodalton AIM had a duplicated first domain. And like typically AIM just has 3, like in people and mice. So they found this group in cats that has 4. And from there, they were kind of talking about how like is the binding affinity of AIM in cats a lot higher than in humans and mice, and is that why potentially like with acute kidney injury, if cats can't release AIM from their IgM, it can't go into the tubular lumen and help with clearance of debris. Could this be why cats have kind of a higher proportion of like CKD? Effectively is kind of what they were trying to look at here. And in the graph here, they looked at like the IgM bound AIM. They had the control groups. Here was like recombinant AIM. So this was the free AIM. And then the IgM bound AIM. So they looked at that first. And then kind of as AKI was induced, they found that it stayed bound to IgM, and there was no like free AIM being produced, which I think there'll be another figure on that in a minute. So first they looked at feline AIM compared to mouse AIM, and the rate of phagocytosis. So this was all in vitro tests for this part. So they isolated necrotic debris from mouse proximal tubules, kind of prepared that in a petri dish, and then they coated it with either feline or mouse recombinant AIM. And then they like compared to see which group had more phagocytosis. So it seemed like it was similar in mice, and then like less so in cats. I think this part is challenging, like for my clinical brain to translate. I don't know that in vivo it would be the same, like they're coating that debris with recombinant AIM. So yes, I'm not sure like how that exactly translates. But that was kind of the first part of what they looked at. The second part, they were looking at kind of, they took the feline gene fame, like put it into the mice, and then compared those mice with the wild type mice for the rate of like renal recovery and survival. So figure A here is like just showing us how they constructed the gene. So the promoter gene like starts off the effectively like lets the gene become active by kind of promoting it and starting it to be read. It's my basic understanding. So they still kind of kept that, the mice part of that was necessary, but then they like inserted the feline AIM segment like just after that. So that's kind of just showing like the mechanism of how they did that. And then what they did in section B here was just confirming the expression of that transgenic feline AIM in the mice. So up here we can see like it was looked consistent with the last images being bound to IgM. There also was a small amount that appeared bound to IgA, I think based off the molecular weight. And then they also had like the recombinant AIM to make sure like these mice didn't have any free AIM spontaneously. So we can see like there's no markers down there. So they kind of confirmed that expression to make sure they were okay with it. And then what they did was like compare the wild type and the AIM felinized mice after they were subjected to ischemic AKI, and they compared the renal values. So again, like day one, both groups became elevated. The wild type then kind of plateau and start to decrease. The felinized group continues to elevate. And then the wild type sham groups like were kind of static down the bottom there. And then they looked at the survival rate as well. So the felinized mice, we can see they all died by day 3 versus the wild type mice. Still kind of 30% of them died overall within, like this is a 5-day period now, but there was a higher survival rate. And then there's some more postcard images, postage stamp images of the histology. And they were just showing there was more intraluminal debris at day 3 in the felinized mice. And then they looked at the acute tubular necrosis score again between the groups, which was statistically significant. It's a 3 versus a 5, so both are certainly very abnormal, but they looked at that also. The next part of the paper was where they wanted to try and prove that feline AIM an IgM kind of communicate, and there's no release of free AIM to then go and be excreted into the renal tubules, as I mentioned earlier. So pretty much here, it's saying like in the wild type, there is like staining of AIM, and then effectively in all of the other groups, the AIM negative mice and the felinized mice, there's no staining of AIM in the renal tubules. So they looked at that first, and then they also like took the serum from cats pre-treatment, and then after ischemic AKI was induced. And here is where like it all seems to be bound to IgM. There's the control free AIM, but we can see like in those cats there's doesn't appear to be any free AIM in their serum. And then similarly, like they looked at that in wild type and felinized mice. And it seemed like the wild type mice, like down here, we can see like did develop free AIM day 1 post injury, whereas the felinized mice here like didn't. So they were kind of concluding based off of that and kind of prior information that the affinity of feline AIM was greater with IgM. It didn't kind of release off the IgM, so it didn't go into the urine, and didn't help with like clearance of the tubular debris. They looked at serum in 4 cats with ischemic induced AKI. They concluded like all cats had poor recovery from AKI. There was no like free AIM identified in any of those cats, and it didn't increase following AKI. So this kind of jumps to like part on the actual cats and not the mice that were modified to look like a cat. Again, like this is 4 cats, and they make like pretty bold conclusions about that. They also like assess the urine of those cats. They tested for the presence of AIM in the urine of those cats based on an ELISA. Again, like I couldn't see any information about like what this test is it validated or not. So yeah, they did test for it though, and it was negative. And then they looked at histology and also KIM1 expression, as we mentioned earlier. And then serum from cats with spontaneous AKI was assessed as well. It was not determined like how they selected those cats. They just said like, for example, renal stones. But they didn't really describe like where those cats came from. But they like tested that in a few cats, and there was no IgM free AIM in the urine of those cats either. I'm going to skip through this slide for the most part. Effectively, they did a test to look at the affinity of IgM and AIM in cats. It seemed to be elevated compared to people and mice. This is the final figure. We can have hope that we're almost finished here. But they looked at the overall survival rate, like this is going back to the mice now. They looked at the overall survival rate of mice that were administered recombinant AIM versus the ones that weren't. And we can see here in their results at day 5, the ones that were administered recombinant AIM had like an 70-80% survival rate versus the ones that weren't. So this is felinized mice only. So the ones that didn't get synthetic AIM like all died by day 3. And then they kind of look at the creatinine values of those 2 groups, as well as the acute tubular necrosis score, and like labeling of AIM in the histology images. And then from that, their big conclusion is that like administering recombinant AIM as a vaccine to cats is going to cause like recovery of AKI, and then B, like reduce the risk of CKD. And then in the conclusion, they also say like it's going to prevent kidney disease altogether. And then they kind of mention that that could prolong cats' lives. So they take some pretty big conclusions about this potential drug protecting from kidney disease altogether, that this study like supports therapeutic use, as well as like supporting health and longevity of cats. So I've not read many experimental laboratory studies like this, but pretty bold conclusions were drawn, and that kind of culminated in people going onto TikTok and advertising about this life-saving drug in cats, and then that going viral, and then people in Los Angeles coming to ask me what this new kidney drug for cats is. The limitations of this paper were pretty major. The methods was very confusing, not well described. It was not randomized or blinded. Again, it was an experimental model. It's hard to know if like the effects in felonized mice like translate to cats. Again, it's mainly an ischemic AKI model, very small sample sizes, very short study period. The tests that were being performed in cats, not really much information to know how accurate and precise they are. I think from here it's difficult to like assess the causation of AIM directly influencing renal recovery. I think it's a pretty like simplified relationship, but I'm sure like there's lots of other factors that could be involved. And then the conclusions were very bold. I think that like these studies show like there's a potential relationship between AIM, KIM1, and progression of kidney disease, though that appears to be different in cats. I think the pathophysiology is still quite elusive, but from these papers we can't like definitively conclude any sort of benefit from recombinant AIM based on this information. And ultimately, we need more studies, more controlled in vitro studies, experimental studies probably to start, and then different etiologies of kidney disease in species, and then obviously like controlled clinical trials looking at diseases in patients of interest, as well as like safety studies for recombinant AIM. So it advises like they're in the clinical trials part of this experiment right now, and it's going to be like available to pet parents in 2025. It's 2025. Certainly like reading pet parents' comments like was very concerning, like looking at the advertising of this on social media. So I think it's like giving a lot of people false hope. I think like potentially they're onto something, but this is like very, very early evidence. But open to like any questions, any thoughts people have about the TikTok drug. Thank you for like watching. That was a lot, at least for me.
That was great.
Oh, I'm glad you think so. Everyone is stunned, I guess.
It kind of reminds me a little
All
bit
right,
of
well-
the of everything around the GS drug, the FIP stuff, except we had more evidence then.
Mm-hmm.
There's going to be
Sorry, the first part cut out, Dr. Byron. Did you say like this is how it started with the GS drug for FIP?
kind of like that, except there was more evidence for the FIP efficacy. But, you know, soon there's going to be a CKD Warriors page, just like the FIP Warriors page.
Yes, I'm sure that will happen. And like the FIP drug seems to work well. So like I'm happy for this to be like, it would be amazing if this could be something that could help cats with kidney disease is so common. But I'm very skeptical, but yes, we'll stay tuned for the Kidney Warriors page. Any other comments?
If nobody has anything else, then I guess we can conclude, and then we will post the link on our YouTube page. All right. Thank you so much.
Okay, thank you all. Have a great day.